Okay, let's pick up at the fissured tongue. If you look at this picture, you will see that there are deep fissures in this tongue. This is not anything that's abnormal. Not everyone has it, but it's okay if you do. The thing that we have to point out is that when you have a tongue like this, it definitely needs to be brushed and a lot of attention paid to it because food and bacteria can grow in these fissures, and so that can be an issue. So we need to be sure that this type tongue has a lot of home care. The other thing that the title points out is attrition. Attrition is, you see the wearing away of these teeth. So that is called attrition. If you will look at the incisal edges here, if we could see the teeth more carefully from the incisal, you actually see where the pulp canal is starting right here in this one. So this is called attrition, or wearing away of the enamel. Again, we have another fissured tongue. This just looks like a person that has a fissured tongue that may have an extremely dry mouth, maybe on a lot of medications. Red, probably not really sore, but just has that appearance. And again, just a different example. So here you have more of the fissures here that are a little deeper, and then in the middle of the tongue. Requires good home care in order to keep the breath from being offensive to people. And again, just another example, fissured tongue. Okay, let's go to what we call the black hairy tongue. And before you jump to conclusions, no, this is not black hair that grows on the tongue, and I'll explain to you as we go through this, but a black hairy tongue is caused by an imbalance of oral flora after the administration of antibiotics. So again, this is a long time of using antibiotics, and the flora in the mouth becomes imbalanced between the good and the bad. So the filiform papilla, which we've talked about before, are so greatly elongated that they resemble hairs. So these are if you think about the fungiform sort of being the circular type papilla, then you have the filiform, which is a little extension that comes out of that. So they elongate. And when we have an imbalance of that, they resemble hairs. So when they become elongated like this, they can become stained by food and tobacco. So that's where we get the name black hairy tongue. It's not black hairs like a lot of people want to think about. So this is an example of a black hairy tongue here. This again is the elongated filiform papilla, probably stained by tobacco. It's not something that a person, it's not going to hurt the tongue or anything like that, and you don't have to be afraid to work on a person that has that. It's just really a discoloration. The tongue needs to be brushed and cleaned, and maybe use a tongue scrape. And again, these are just various pictures with different degrees of the black hairy tongue. This one definitely looks like tobacco to me. Okay, all right, let's move on to orofacial piercings. We know that they are popular. A lot of people have those now, but there are dental complications that include, they don't think about how damaging it can be to the teeth and the tissue, but these things can chip and break teeth, injure the palate. They can have erosion of the soft tissue, especially the lingual to the mandibular anterior teeth. Because typically that's where it's at. It hits the mandibular lingual. They can have serious infections at the site of the piercing. And the thing with the tongue and the piercings and the lips and all, infection can spread quickly through these areas. They're have a lot of blood supply, and they can spread very quickly. And the danger is, the piercing is in the mouth, which is there at the neck and the head, and also that area. So it can be a very serious infection if that happens with any of these piercings. And let's think about the number of bacteria in the mouth. So it's a high risk type thing, even though people think, it is just a fashion statement, it's really can be serious. Okay, so here we have some pierced tongue with some, we just called it jewelry. I know there's specific names. Okay. All right, so let's move on to something else that affects the tongue. It's a type of anemia, pernicious anemia. It's a condition in which the body does not absorb vitamin B12. So people with this condition show signs of anemia, weakness, pallor, which means that they're very pale, and fatigue. So other signs may include nausea, diarrhea, abnormal pain, and loss of appetite. Oral manifestations of pernicious anemia include angular cheilitis, remember that's at the corner of the mouth, ulceration and redness. Then we have the mucosal ulceration. So again, ulcers, loss of papilla on the tongue, and a painful burning sensation of the tongue. Saw multiple patients through the years that would say, my tongue burns, I have a burning tongue. And we need to look at this and their B12 levels. Okay, so again, pernicious anemia, and here you look at the tongue, it's very pale, doesn't have the papilla like we would normally see. So this is something that the patient would need to go to the physician and have blood work and be diagnosed. But again, the dentist and hygienist and assistants can pick this up a lot of times, especially if a patient tells you they have a burning tongue. Think about the B12. Okay, now let's talk about bumps that can be found in the mouth. First one we're going to look at is called fibromas. These are benign tumors on connective tissue, usually caused by irritation on the lip, tongue, labial mucosa. Usually these are the sites that they'll be found. The treatment for them, they can be removed, or you can remove the irritation and hopefully that will take care of it. They can be removed and biopsied. Sometimes they will come back if the irritation's not removed. So they're called fibromas, usually benign. Okay, so this is an example of two fibromas. So here you have this large bump, and this can be real scary if people find these in their mouth. They think it's something more serious, but the dentist can usually diagnose these just by appearance, and here you have one. This one would be, I would imagine, maybe would be the biting on the cheek. Okay, so another example of a fibroma on the mandibular lip. And here's one on the apex of the tongue. You see it here. And this is a larger one. They can be removed. A lot of times they will reoccur. Okay, this is a mucocele. So a mucocele is a mucus cyst of oral mucosa. Usually it's trauma to a minor salivary gland. It appears as a bubble on the inside of the lip, and occasionally a stone-like particle may block the saliva duct opening. So let's look at this. This is a mucocele. Now, how can you tell a mucocele from a fibroma? A fibroma is a tissue. A mucocele is filled with liquid or a watery substance. So what will happen with a mucocele is that it will come up like this. It may be there a few days. A person will either press on it or bite on it, and it will rupture and a watery fluid will come out of it and it'll go away. And then it will reoccur. It will gather the fluid and reoccur again. So that's called a mucocele. No real danger with them, but it can be irritating to the patient. So that's the difference between a fibroma and a mucocele. Okay, so here we have some more images, and in this one you can see the watery substance in it. And again, the dentist can usually tell this by appearance and by palpation. And another mucocele. This is very large. Okay. So we just have some histology here of the mucocele. That's what it would look like under microscope. Okay, so let's move on to the Fordyce granules. These are small yellowish bumps, usually seen in the labial mucosa. They are related to the sebaceous glands, often noticed with injury and enlarged. So this is what we're talking about here. Fordyce's granules kind of have a yellow appearance due to trauma. All right. So let's go into our periodontal disease just for a few minutes. I'm not going to spend a lot of time here because we've talked about this tremendously throughout the year, but let's just look at the periodontal disease quickly. Healthy periodontia, I think you would know that that's less than 3